And I think being a doctor and having a patient that's so young, ovarian cancer is probably not something that's on my radar. Do you have advice for other women, maybe that are younger women, in terms of getting some attention quicker, or maybe pushing the issue a little bit more?
My advice to them would just always be your own health advocate. You know when something is wrong with your body, and you know when you're not feeling healthy. And your health and your life is what's most important. You're not bothering doctors by going back to them. They just know something is wrong by you being persistent. And as a younger woman, I think if I tracked my cycle much more closely than I do now, they would be aware of what might be wrong. You might be able to tell when something's off because your normal cycle changes. And I think that's really great information to gather when you go see your gynecologist or your primary care physician, because that can help with either getting the test done or leading to a diagnosis.
And although you might have said a little bit of this before, do you feel like when you went to the healthcare provider with your complaints that you were taken seriously enough?
I think I was taken seriously by my primary care doctor, but we did rule out, it was first maybe IBS, it was first maybe something gastrointestinal, then it could be a bladder infection, a kidney infection. So it was all the issues that a female would have, but she didn't pinpoint quite yet what the problem was.
Right.
But it was her making sure I'm getting the right tests and doing those things that it's found, because that's normally how it is found.
Excellent. Do you have any advice for patients going to their provider on what information they can bring with them?
Sure, absolutely. I'm actually now part of a program called Survivors Educating Students. And I start with college students, and I advise them to journal, because I feel like it's a habit if you start when you're younger, that little things that you will pick up the consistency of seeing something 1, 2, 3, 4 months in a row, and some people it could be years in a row. So the journaling, I really feel, saved my life. And don't be ask questions. If it's something that maybe is not normal to you and you're hesitant to ask the questions, I feel that it's really important for women of all ages to share your symptoms, because as we saw with our group today, we are all different ages but very similar symptoms, and all of a sudden you're standing in front of your doctor and you're nervous and you're not remembering exactly what happened. So to have that journal there, I feel, is key.
So as Andrea mentioned, it's really important to journal, and when you come to your provider, I think it's really important to focus especially on new persistent. So the type of abdominal distension that I experienced, I had never, ever, ever experienced in my life before. And that's important information to communicate, and how different it feels. So over time, and highlighting new persistent worsening is very important. And if people are interested, on the Citizen Science for OvarianCancer.org webpage, under a tab that says, at the moment anyway, I know things can change online, but at the moment the tab is called Not IBS. And in there's a PDF that writes out the symptoms and how it can help you journal for a couple of weeks. We've been recommending 4 to 6 weeks. Is that about the right time frame that you would suggest?
I think that's reasonable. That would give me a lot of information to go on.
Okay.
So you guys have, that's great advice for patients to keep in mind. Is there any other advice that you would have for women that are having what we might call vague symptoms?
If you have a normal routine that you normally do, and what you're feeling is stopping, like you mentioned, you stopped working out because you were feeling your exhaustion, and I was also exhausted too. That if all of a sudden you feel like you don't have the energy to do things you normally like to do, or you're feeling that pain, or you're stopping to have to use the restroom more, all those things become annoying and you're not enjoying your life as normal. Those are big signs to pay attention to.
There's a saying, trust your gut. And also with ovarian cancer, it's that suite of symptoms. So as you mentioned, one of the symptoms might be ignored. If you start noticing there's more than one of the symptom, that's a red flag. And really, pull out some form of journaling in any way that works for you and get to the doctor.
Do you guys feel that when you noticed that there was a persistence of these vague symptoms and you brought it to the healthcare provider, that you were taken seriously and that they were acted on in as fast a manner as you would have liked?
I do, absolutely. Because you do start to feel a little crazy, right? I'm sure everybody thinks like you watch TV or you Google something's wrong. but I did receive excellent care, and I definitely felt, when I went in, they were very, they were concerned and they were trying to figure it out, but, as you know, being a doctor, it's hard. Not everybody who has these symptoms has ovarian cancer, but I was definitely listened to.
That's a great question, and one of the things that I know I've experienced, and I've talked to a couple other ovarian cancer survivors that they also experienced, was that we just weren't in the high-risk group. So I didn't take fertility drugs. I wasn't over 63, which is the average age for ovarian cancer. I don't have, well, they hadn't tested me yet, but there's not ovarian cancer in my family. So I didn't fit in a high-risk profile. So no, my original vague symptoms were all chalked up to something else. Nobody thought, even before my surgery, I was still given very good odds that it wasn't going to be ovarian cancer, that it was just going to be a benign cyst complex.
Trust your gut. Give ovarian cancer a voice.
It used to be called the silent killer, but if you listen, it will talk.